Hi, it's James from decaf.com, the UK's leading decaffeinated coffee brand. Today, we're going to ask the question: does caffeine affect Meniere's disease? Meniere's disease is a condition of the inner ear that causes sudden vertigo and tinnitus and affects an estimated 12 in 100 people globally. The cause of Meniere's disease isn't known, but scientists believe it's caused by changes in the fluid in tubes of the inner ear. Other suggested causes include autoimmune disease, allergies, and genetics. There is no cure for Meniere's disease. Meniere's disease cannot be treated and is a progressive disease which worsens, more slowly in some and more quickly in others. Some patients experience periods of remission for no apparent reason. So, does caffeine affect Meniere's disease? A lot of forums and health websites recommend avoiding caffeine in coffee as it has stimulant properties that make the symptoms of Meniere's disease worse. Indeed, some health professionals believe that caffeine also may make tinnitus louder, as well as trigger migraines. But, what do scientists say? The best research so far conducted was by scientists, led by Kiran Hussain of the Faculty of Brain Sciences at the University College of London, who conducted a study entitled Restriction of Salt, Caffeine and Alcohol Intake for the Treatment of Meniere's Disease in 2018. This was a very basic study. It did not involve tests or volunteers, but was simply a search for high-quality studies of dietary changes, salt, caffeine and alcohol restriction, compared to no restriction in adult patients with Meniere's disease. And, what was the result of this research? The scientists did not identify any randomized controlled trials that met the inclusion criteria for the review. There is no evidence so far from randomized controlled trials about the restriction of salt, caffeine or alcohol intake in patients with Meniere's disease or syndrome. They concluded that high-quality research in this field is needed if this question is to be answered. They recommended that a study be made that uses rigorous methods and carefully recruits only patients that meet accepted Meniere's disease diagnostic criteria. In short, this study simply concluded that there has not been enough research in this area and more research is needed. Let's hope a scientist takes up the call. So, the answer is unclear and more research is needed. To find out more, please visit www.decaf.com or check out our YouTube channel for more videos on decaf, caffeine and coffee topics.